in the next 10 minutes, I'm going to walk you through some of the data that we've collected from countries and from our partners around the rapid uptake and adoption of the 2013 guidelines, and look at this as a way of paving the way to achieving the 90-90-90 global targets. So I have no conflicts of interest. In terms of the background, the progress towards ending the AIDS epidemic by 2030 critically depends on adoption and implementation of the global guidelines that address evidence-based approaches to optimally treat and deliver HIV services. In the 2013 Consolidated Guidelines, we had over 50 new and updated policy recommendations on clinical, operational, programmatic, and M&E aspects of treatment and care. And after we launched that guideline in July 2013, we went on what we called the roadshow of dissemination. And from August 2013 to May 2014, with our partners, we conducted 9 dissemination meetings across 6 WHO regions, serving more than 100 countries and across several different languages. And since that time, we had established what we called our database to be able to monitor this. And we started out by triangulating data that was available from baseline surveys from these dissemination meetings, annual e-surveys with national HIV program managers, peer-reviewed literature, national strategic plans and concept notes that go into the Global Fund. And with that, for this analysis, we compared this to the end 2014 Global AIDS Response Progress Reporting, or something called the GARPR. And those discrepancies that were found between all of these different data were verified at the country level with HIV program managers. We also looked at the barriers to implementation with a program manager e-survey that we conducted in anticipation of the 2015 guideline meetings. And I'm going to present both of these at the end of 2014 data for both the 144 low and middle income countries, as well as our 58 focus countries that have the highest burden of HIV. So in the next several slides, I'm going to show you a series of maps. Don't get too overwhelmed. I'll try to walk you through each one, and at the end, I give you a little summary about each map. And I'm highlighting some of the most important key policies, both on the adoption of the recommendation or policy and implementation. So we're at the point of we're measuring implementation as well. And there is a difference. So this first map shows the policy uptake for the threshold of initiating therapy for adults and adolescents. And what you'll see as for green is treating all, orange is treating at a threshold of less than 500, darker orange is a threshold of less than 350, and red is a threshold of less than 200. And as you can see across the board, most of the countries are either at orange and several large countries at green. So overall, 53% of those countries have adopted a threshold of less than 500, and 6 have moved on to treating all. Now in terms of implementation, here it's the opposite. Red is not implementing at all. Orange is done in a small number of treatment centers. Yellow is done in a large number of treatment sites, and green is full countrywide. And of course here we've had some lack of data where we don't have full reporting from countries. And what you can see here is for implementing a threshold of 500 that we have several countries that are still not fully implementing, with the dark red in Africa. And over the 104 countries that did report, 52 were reporting countrywide implementation of the threshold of 500. In terms of PMTCT, this has been a fairly rapid uptake and rapid implementation of this new guideline and recommendation. And green is the adoption of B+, orange B, and option A is red. And as you can see, almost uniformly we have option B+ being adopted. And this is 95% of countries in low and middle income areas between option B+ or B. But in terms of implementation, what we'll see here is greater variability, where you see in the reds and the dark oranges where there's either no implementation or partial implementation of option B. But yet in several other places, full implementation with the green color. So what we have now is full implementation of B+ is 65% of those low and middle income countries reporting. In terms of children and adoption of the recommendation to initiate therapy at Less than 1 year is this light blue color here, seen in Brazil. Less than 2 years is a darker blue color. Less than 5 years is the darkest blue, and green is treating all children. So you can see in some areas in sub-Saharan Africa, there is a movement for treating all children, and certainly across Africa and Southeast Asia, treating less than 5 for all children has been well taken up. And so we've got 40% of low and middle income countries adopting a policy of treating all less than 5, and 3% treating all children. And again, that implementation is variable, but what this slide shows here is that across all policies for pediatrics, we have fairly good implementation, but yet those countries that are moving towards treating all, for example, Tanzania, have not yet implemented, whereas Uganda has. So that's going to be variable over time, and we'll continue to monitor it. So the implementation rate is approximately 81% for pediatrics. So for B+ and peds, we're doing quite well in terms of implementation. For the recommendation of treating all serodiscordant, the positive partner of a serodiscordant couple, again, the green shows that there's broad uptake around the world. The orange is not uptaking that policy. But overall, for low and middle income countries, it's only 65% that have taken up this policy. So several countries aren't reporting on this policy. In terms of taking up and adopting the tenofovir 3TC efavirenz first-line preferred regimen, it's pretty much green across the low and middle income countries, with most countries adopting this as a preferred first line. We have some challenges in Eastern Europe where they have multiple first lines that don't include our first line that we would recommend. So 80% uptake of that. And lastly, in terms of my maps, this is the recommendation around uptake of viral load. And what you can see for the dark purple is routine viral load monitoring. The lighter purple is targeted viral load monitoring. And no recommendation is in yellow, and white represents countries that haven't reported. And what we see is approximately 63% of countries taking up routine viral load monitoring. In terms of implementation, it's a little less. We don't have the full implementation there, and we're in the actively trying to identify how well that's being implemented and triangulating that data with some of our partner data, such as CHI and ASLM. And we know that implementation is quite a bit lower than the adoption of this recommendation. So now I'm going to switch gears and talk to you about our 58 focus countries. Now this slide is very busy, but it's to give you a sense of what is the diversity of uptake of different policies across the different regions. But what you can see is in the middle here, option B and B+ has been nearly 100% taken up across most of the regions as a policy, as has the tenofovir XTC and efavirenz recommendation. We can see greater variability around the uptake of treating all less than 500 or even treating all, but this new treating all column and bars have over the last year crept into our data, and it's exciting to see countries in Sero, countries in AMRO, in the Americas, and in the Southeast Asia really taking the lead there. So overall, very good uptake but adoption and implementation, as I've shown you, is not one-to-one. We also follow the uptake of service delivery and integration policies in our 58 focus countries. And what we can see is that TB treatment here in the second set of columns, and these colors are policies for adults in blue and policies for children in green. And the uptake of policies of integrating TB treatment into the ART settings is fairly well taken up, but all the others are less well taken up. And in particular, the lowest or the poorest integration is ART being brought into opiate substitution therapy settings. And these recommendations have been around for a while, and I think that this is something that we need to focus on in terms of optimizing our service delivery approaches. This last slide I want to show you in terms of data is around our program manager surveys that I mentioned. We did a survey of our 58 focus country program managers. We got respondents of 41 of those 58 countries. They had good diversity in terms of the numbers who responded, from the generalized on low prevalence and concentrated epidemics. And what I'm showing you here are we asked a series of questions about barriers and challenges to expanding treatment. And here are the top 3 requirements to enable your country to expand ARV to treat all for the various groups. And you may not be able to read this very clearly, but it goes down by lines from adults to children less than 15 to adolescents to pregnant and breastfeeding women, key populations, and positive persons of the serodiscordant couple. And the areas that are the broadest are the orange, which are increase the country funds and the country Ministry of Health allocations to these areas, especially for adults and children less than 15. And for those areas in pregnant women, key populations, and positive partner of a serodiscordant couple, there was certainly a request for more training for healthcare workers. More knowledge in the blue was not what was needed to get this work underway in the countries. So the summary of the results are, within 18 months of the launching of our guidelines, we had 100% of our focus countries adopt at least one major recommendation. 60% of those 58 focus countries had adopted less than 500, 7% had moved on to treating all at any CD4 count, 93 of the focus countries had adopted our first preferred first-line therapy, and variably between 60 and 90% adopted some elements of the integration approaches. Our program manager surveys calls for greater preparation for healthcare services as we look towards treating all, increased domestic investment in donor support, and training. So in conclusion, with the 2013 guidelines, we brought together over 50 new and updated recommendations across the continuum of care. We will be doing the same in the 2015 consolidated guidelines that will come out in December. WHO will continue to support countries to rapidly adopt and implement these new policies, and these full implementation will lay the foundation towards achieving the 90-90-90 targets. So with that, thank you very much. I'd like to thank my co-authors and those at WHO and contributors.